The board has developed, we think, very, very successfully from those early days. It's certainly starting to address some of those key issues. We've got through the bit of just getting to know each other a little bit better. But it feels like everyone in the system is keen to take advantage of whatever opportunities there are there.
It's a big meeting. There are people there from the local authority, so the Mayor herself chairs it, and the local authority have lots of members there. We have primary care commissioners, and there are 2 commissioning groups in North Tyneside, and both myself and the chair of the other commissioning group attend all of the meetings. PCT send representation. Both of our large trusts, so Northumbria and Newcastle Foundation Trust, send representatives too. So it's a very wide-ranging group of people who attend the Health and Wellbeing Board.
I guess some areas have allowed Links representatives, either some Links officers, some Link board members, a Link chair, so there's quite a range of representation. Other areas have said actually until Health Watch is set up, we'll be looking for maybe somebody else to bring those views forwards.
It's been a fascinating experience actually. It's a bit like building a new football team and getting players to work together that haven't kind of really played together before, and just seeing people obviously who knew each other but hadn't sort of got together and worked on specific things before. So I think that people getting used to working as organisations, as individuals, has been really interesting.
Well, I suppose we see it's an opportunity. There's always been lots of integrated work in between the different organisations in the past, but this is an opportunity for a coterminous group of GPs and clinicians to work alongside local authority services, potentially pool budgets, potentially jointly commission all sorts of services. So we can see we get lots and lots of benefits from this arrangement. So in that sense, we're looking forward to it. But as I say, it's still early days and we're still finding our feet.
So far, we've seen a huge amount of energy from the partners who've come together around the table. We've had several sessions now where we've thought in great detail about what our priorities for the city are. And it's very clear that it's about well-being, not just delivery of health services, and it's about making sure that we give everybody an opportunity to access good quality health in local communities. And I'm really optimistic that this is going to be the formative partnership for our city's priorities as we move forward.
In the sense that if you look at the size of the challenge we have in Middlesbrough in terms of health inequalities, in terms of health outcomes, we have what's proposed in the membership of the Health and Wellbeing Board, the key people who have an impact on health inequalities. Health inequalities can be tackled at different levels, both in terms of access to health and social care services, in terms of prevention, lifestyle risk factors, but more importantly, in terms of tackling the wider determinants. And health and wellbeing boards have the opportunity to bring together all those key or major decision makers within a town together to have a more integrated way of tackling health inequalities.
I think what's really positive about it is that for the first time it brings the whole system together. So what we've had in Durham, for example, in the past is a really good relationship with the PCT, with the Hospital Trust and with the Mental Health Trust. But one of the missing pieces of the jigsaw has really been the GP interface. So we've now for the first time got all of those organisations in the room together with senior officers of the council and critically some of the elected members. So in Durham we've got the portfolio holders for adult services, children's services and health, so that we can have a real shared understanding of some of the challenges and agree on some of the solutions.
What for me is really important is for the first time, really, the major acute hospital provider for Middlesbrough is actually at the table discussing the health and well-being of the whole population, which for me is a new experience because we haven't been able to participate in those kind of discussions before. And I think it has enormous potential for us because I've never understood why we weren't included in those discussions.
There is an ideal opportunity for true partnership working, and this is a time for us to look at true partnership and not tokenism. And I think for a long time we have struggled with having representation on a board as particular of this when they're looking at service delivery, impact of services, changing services for the better. I think it's really important that we start the way we mean to go on and have true partnership working.
Well, I'm not sure that things are difficult, things are different. So what's different is that we speak different languages. So when the local authority uses a word, it may not be the same way that people from the health arena use that same word. So one would be commissioning, for instance. I mean, it's an obvious example, but we use it in different ways sometimes. And so it's those sorts of arrangements where we just need to spend more time in the room together to make sure that we become more familiar with each other's language.
I think one of the difficulties with any board made up of busy people is getting everybody together in the room at the same time. So actually managing the diary so that everybody can attend is challenging. And I think what was difficult early on was people starting to get to know each other. So some people who are members of the board know each other really quite well. For others, they were meeting for the first time and starting to develop relationships. So for elected members, for instance, they may have been familiar with some of the council officers and some of the chief executives in health, but had never met some of the CCG, GP representatives.
Every stakeholder around that Health and Wellbeing Board is there with their own structures, their own work plan, their own way of making decisions, of taking quite high-level responsibilities. You have a Health Watch representative on that board that has to have an overview of everything, all service to do with the patients and the public. So I think we need to be right with the individuals that we are expecting to put onto this board. Because if not, it causes disempowerment, and it could have the potential to be seen as tokenistic.
I think our biggest barrier is the lack of resources that we have to establish the partnership. And what we as a city council have done is put in some staffing resources to enable it to get established. And I guess the other challenge is getting people to think outside of a meetings culture, because it's very easy to assume that partnership is what happens in meetings, in working hours. And for me, the true value of partnership will be tested when each organisation who are represented around the table come to set their priorities, set their budgets, because that's when we'll see whether partnership working is really happening, when people start to align what they do as organisations around the common agenda that we've defined as partners together.
It's the challenge in terms of having that ongoing dialogue. So actually throughout the year we're building that voice and that picture of view, so we're not just necessarily getting that one single view at a day at a meeting. But it's also, I think, a challenge in terms of how we bring the voices of other third sector organisations, so some of those smaller groups that are operating in the local area, providing health and social care services, or perhaps providing support and advocacy for individuals as well. And it's how we bring those voices, those wider voices from the third sector, alongside the voice from Links and those patient voices as well.
The key thing that will make this happen or not happen is relationships. So we keep saying, what's your relationship like with this organisation or that organisation? Well, my view always is organisations don't have relationships, people do. And when we get the people working together, we get those relationships right with people, I think we will be able to make quite some significant differences in the way that we need to.
We know in the North East we have huge issues with smoking, with obesity, teenage pregnancy, all of those sorts of things. It's good to know that these are shared priorities across both the local authority and the health sector, so we can take what we've learned at the board and take this back to our groups to help us to inform our commissioning plans.
I think health and wellbeing boards have the potential to make a difference, and much of this depends on the relationships that people will be forming as the health and wellbeing boards develop. Certainly in Middlesbrough there is that enthusiasm. Yes, whilst we realise that there is a big challenge in terms of tackling health inequalities, improving the health and well-being of our local population, but I must say everyone sat around the table is up for the challenge.
Well, we have to empower our officers once we've got, we've got clear ideas. For instance, working on emergency care and urgent admissions, where we have to empower people, who are much closer to the actual delivery of care, to actually now start making improvements, and we need to try and through our leadership get people to work much more closely together.
Just really, all the partners getting together with a single aim of how we can improve health outcomes in our towns, and actually saying we're all about the same business. We haven't really had that group of people together and saying let's get behind a single aim here.
Often partnerships have been defined by people round a table, badges and names and organisations. For me, the Wellbeing for Life partnership in Newcastle is a once-in-a-generation opportunity to transform what we do as a city, to transform people's lives and to make sure everybody enjoys a long, healthy life in the city, regardless of their background or circumstances. And to do that, we have to think across boundaries, we have to think across organisations, we have to think across professions. We have to be far more joined up than we have been in the past. We have to be far more strategic about how we use our limited resources. And so, for me, the partnership is not just a coming together of organisations, it's a meeting of minds around a common agenda that we use as a platform for improving health and wellbeing in Newcastle.